Namaskar. Myself, Dr. Mahesh Dadhich. I am Senior Consultant Anesthesia and Critical Care Medicine. This presentation of CPR Basic Training Program is for DITF viewers. The cardiac arrest occurs in any age nowadays, and it is common in younger people as well. When we are able to recognize the cardiac arrest and start basic life support for the cardiopulmonary resuscitation, then we can make the person survive. In cardiac arrest, either the heart is arrested or the lungs have arrested, no breathing, or both things have happened and the patient's heart is not beating and the respiration is not there. The CPR consists of providing care to such persons till arrival of qualified medical aid without the use of any drug and equipment. We use our own skills and only hands and our breaths to rescue the person from that crisis. This is very important. So we see when a person on the roadside, we should take the person to a safer side so that the victim as well as the provider are safe. Then we should check for any help that we can get from the bystanders, and we should check for presence of any respiration by putting our back of the hand, dorsum of the hand near the nostrils, and see if it's breathing or not. Then at the level of thyroid cartilage, we go on the side, any side, either side, and at that level we check the carotid pulse. The carotid pulse is present only when heart is beating. So if the carotid pulse is absent, that means the person's heart is stopped and is not breathing as well. So we should immediately start CPR. The time taken for diagnosis of total cardiac arrest should not be more than 10 seconds. When we start CPR, it consists of 3 steps: C, A, B. C is for cardiac compressions, A is for clarity and maintenance of the clear airway, and B for breathing. This is the sequence to be maintained. The person is to be on the firm surface, on the ground or on a table or on a bed which is hard enough. And then we mark the point at which we have to press. We come from the abdominal side. As we come up, the Ditf sternum is felt, and from there we put our 3 fingers, and above that line crosses the intermammary line. This is center of the body of the sternum. We should press at this point. The heart is compressed at this level between sternum anteriorly and body of the vertebrae posteriorly. So we place our base of the hand at the center of the sternum. We put another hand over it and we lock our elbow joint. We bring our shoulders above it and we use our body weight to compress the chest. The rate of this compression must be around 100 to 120 per minute. But the number of compressions that have to be given in one cycle is limited to 30. After 30 compressions, we should maintain a clear way and provide breathing as well, because the oxygenated blood is required by the vital organs. So when we maintain a clear way, for maintaining the clear airway, we have to push the mandible and thrust it anteriorly. This way, we push the mandible along with the base of the tongue, and the airway is maintained clear. Then we give breathing by using our own breath. Mouth to mouth breathing is preferred. We close the nostrils of the victim and we put our mouth, we take a deep breath, we put our mouth on the person's mouth tight and see at the same time we have to see the movement of the chest, whether the chest is moving with our effort. So if the chest is moving, that means the respiration, the breathing that we have given is quite effective. Again, after two breathing, we have to start recompressions. 30 compressions again followed by 2 breaths. This consists of 5 cycles to be given in 2 minutes time. 30 compressions, 2 breaths, 30 compressions, 2 breaths, and 5 such cycles are to be administered during 2 minutes time. After 2 minutes, if you are able to continue, you should continue, or else you can seek help of other guys who are present by your side to come and help you in compressions. You can give breaths and they can compress. This way you are not going to get tired, because the CPR program has to be continued till the victim gets a medical help or he survives. He comes round, he starts breathing and you feel his pulse present. Till then we have to continue our CPR. There are many causes of cardiac arrest that we come across. In our home, we can get electric shock. We see at our working place, we see somebody getting electric shock and just collapsing on the ground, unconscious. Sometimes the heart may stop. Sometimes there is accidental blockage of the respiratory tract. The foreign body, like any food or anything, is occluding the laryngeal opening and the person feels suffocated. In case of electric shock, we have to take the victim to the safer side. Just simple cardiac compression and the center, or just a thumb will do the job, and the heart may start contracting. Or else, if does not respond, then we have to continue with compressions. And after 30 compressions, if needed, respirations to be given. In case of choking, when the person is holding his neck and is unable to breathe, is suffocated, we go at the back of the patient, we just above the umbilicus, we put our hand over there, another hand over there, and then we push upward. This pushes the diaphragm from the center towards the trachea, and the air in trachea is displaced and throws out the foreign body at the laryngeal opening. We should know that the capacity of the lungs is 3 to 4 liters. And the volume of air that we either inhale or exhale is only 500 ml. So all the time there is at least 3 liters of air present in the respiratory tract, in alveoli and in the trachea and bronchial. So that air we utilize for throwing away that foreign body. Sometimes we come across drowning cases as well. When the person is suffocated, the heart is still beating, we bring out the person from swimming pool or the river or in a pond, and we find that he is drowned, he is not breathing, or he is in difficulty. We should not waste time in putting him in prone position to bring out the water. The water has already entered into the tracheobronchial tree, the larynx is closed, so it's already there. Damage has been done. Now the person is holding his breath and the epiglottis is closed. So his laryngeal opening is closed. So we put the patient on his back in supine position, turn the person's face on side. As this part goes below the shoulder, the water that is there in the oropharynx and in the nasopharynx comes out. And immediately we should ventilate the patient. We should make the patient breathe. So what is needed in this case is that we give 4 to 5 rescue breaths to this person. one after the other. After 4 to 5 breaths, the air entered into the tracheobronchial tube will make its own way through the water to the alveolar tract, and exchange would occur, and the person would start getting oxygenated blood. So this is the first requirement, that we breathe the patient, make the patient breathe, and after 5 breaths we start CPR, 30 compressions and then 2 breaths to be followed. This cycle to be continued till the patient recovers either or medical help is arrived. Thank you so much.